Good evening, everyone. Welcome to Facebook Live. Kim here, back from Florida Orthopedic Institute. We're on the sidelines of the Newsom High School football game with physician Eddy Echols. Hi, Dr. Echols.
Good evening. How you guys doing?
Dr. Echols is one of our sports medicine specialists at Florida Orthopedic Institute, treating student athletes and those who get injuries from sports, as well as shoulder and elbow injuries in the upper extremities. So Dr. Echols and I are going to speak about fractures in student athletes this evening. As always, feel free to comment and ask questions if you have them. Like our page, be sure to share this, and let all your friends and family know the valuable information we're providing. So Dr. Echols, we're going to get into student-athlete fractures.
Okay.
What areas do these fractures occur in the upper extremity?
Well, okay. Well, as far as fractures go, and this is kind of back up, you know, a lot of times I get the question, is it broken or is it a fracture?
Yes.
And actually those are one and the same, okay? So when you break a bone, the technical term is a fracture. And to your question, the fractures can occur anywhere in the upper extremity, whether it be the shoulder, the arm, the forearm, the hand, or the wrist.
Okay, perfect. And what are some common causes of these injuries, specifically in our football players? How do they occur?
Okay, well, specifically with football players, obviously the main mechanism of injury is contact. So obviously just about anything can be broken, obviously in football, if you're hit on it the right way or if you land the correct way, that can end in a fracture.
Okay, and if we need to get treatment options done for these fractures, I would assume that they always need to come see you or another orthopedic specialist at Florida Orthopedic Institute. What are the conservative treatment options? Is it always surgery?
No, it's not always surgery. And as a matter of fact, you know, one of the things that we provide here at Florida Orthopedic Institute, as you can see, we're out here at Newsom. We have a number of network of athletic trainers that are out at the schools that we basically try to support our student athletes out here. Now, that being said, obviously, if in fact they're evaluated and the trainer feels that there's a need for further intervention, then they come to see us.
Okay.
Yes. Now, to that end, it would obviously depend on what type of fracture it is,
Okay.
and how displaced it is as to what the treatment options would entail.
Okay.
Obviously, our first objective is to try to see if we can treat this non-operatively. There are going to be certain injuries, obviously, that will lend themselves more readily to surgery,
Okay.
But that obviously is not the first option.
Okay, great. We don't want surgery to be the option at all costs. So what happens if the student does have to lay off of their sport for a little while? Can they come back and play at the same level of competitiveness as they were prior to the injury occurring?
And that's usually the case. Obviously, as you know, our motto is to keep people moving.
Keeping you active.
Exactly. So, that being said, routinely, the patients can come back and play at the same level of competition. That's usually the rule as opposed to the exception.
Okay.
And that's our goal.
We have a question. What is the question? What steps do you take to treat an injury or fracture that didn't heal properly the first time?
Okay. So obviously there are a lot of caveats to that because it would depend on where the fracture was, what type of fracture, and then if it didn't heal properly, was it severely angulated, displaced, things of that nature. Now, one of the things that comes into play, because routinely in this population, a lot of the growth plates are still open. So it lends itself to the fact that things can remodel. So depending on the actual injury and the fracture type, that would kind of come into play as to how we would treat that. Usually, things will heal, and if you give it enough time, things will kind of align themselves. Most of the time, if in fact it's something that we think may not heal properly by itself, we're probably more so inclined to offer surgery early on.
Okay, good to know. And last but not least, how do we prevent fractures from occurring? Are there any preventative factors that can go into play, especially with our high-impact sports?
So particularly with our high-impact sports, I think the most important thing that we can control is conditioning.
Okay.
A lot of times when the athletes become fatigued, then our technique breaks down, which then lends us more prone for injury. So the most appropriate thing is conditioning, strength training, and things of that nature. Like I say, the game is won before the season starts.
Okay, and so other factors that go into conditioning are what? Drinking a lot of water, eating a proper diet, getting proper sleep. Give us a couple more examples.
I think really in this instance, we have practices that start before the season. And to that end, yes, proper conditioning. Obviously, the things that you speak of are great, from nutrition, strength training, and getting your conditioning, your stamina up so that you don't fall prone to early fatigue.
All right, great. Thanks, Dr. Echols. Is there anything else you want to add to our student athletes? Any tips to avoid fractures or any other information that parents may need to know?
I think the key thing is making sure that the students are getting proper rest, to make sure that they are actively going through their training, they're paying attention to what is being done, because all it takes is a lapse, and injuries can occur, easily. So the most important thing is just attention to detail and preparation.
All right, excellent. Thanks, Dr. Echols. We're excited to be here on the sidelines of the game tonight. Stay tuned in for more Facebook Live series. Again, as I mentioned, ask questions. We'll get Dr. Echols to answer them for us. We wish these guys the best on the field tonight, and we will see you soon.